Hello and welcome to Working Wise, a podcast created and produced by K&L Gates. Each episode is designed to provide labor and employment updates and compliance tips to lawyers and HR professionals. We hope you enjoy this podcast.
Welcome to K&L Gates' Working Wise podcast series. My name is Melanie Stratton Lopez, and I'm an associate in the Raleigh office of the firm's Labor, Employment, and Workplace Safety Practice area. Last week, the World Health Organization declared the 2019 novel coronavirus a global health emergency. As of February 11, 2020, there were over 43,144 confirmed cases of the virus in more than 24 countries outside of China. Many employers in the United States are wondering what they can do to stop its spread into workplaces and protect their employees. Today, in this podcast, I will answer some of those questions for you. The first question you may have is, what are the signs and symptoms of infection? According to the Occupational Safety and Health Administration, or OSHA, and the Center for Disease Control, the CDC, signs and symptoms of the 2019 novel coronavirus include fever, cough, and shortness of breath. Now that you know the symptoms, you probably want to know what you can do to stop the spread of the virus in the workplace. In response to that pressing question, OSHA has published a safety and health topic on its website addressing the 2019 novel coronavirus. The website includes background information on the virus, control and prevention steps for the virus, and the applicability of certain OSHA standards. It also includes resources from the CDC and the World Health Organization relating to the virus. OSHA has also updated a fact sheet called Protecting Workers During a Pandemic to address the 2019 novel coronavirus. While no government body has declared the spread of the coronavirus a pandemic, OSHA's fact sheet includes effective and simple worker protection measures that employers can implement, such as practicing social distancing, including avoiding shaking hands or avoiding large gatherings of people, reminding employees to cover coughs and sneezes, maintaining frequent hand washing with soap and water for at least 20 seconds, and cleaning surfaces frequently. According to OSHA, employers may consider installing hand sanitizer dispensers, providing facial tissues, cleaning agents, and, where necessary, providing personal protective equipment like surgical masks or respirators. OSHA and the CDC also recommend training employees on infection control measures. It is a best practice to document all safety trainings provided to employees. If an employee becomes infected with the virus, an employer should instruct the employee to stay home for up to 14 days and require a return to work notice from the employee's treating physician. Similarly, if an employee shows symptoms of the virus, or if an employer suspects that an employee has become infected with the virus, an employer can instruct the employee to stay home for up to 14 days and require a return to work notice from the employee's treating physician. In order to ensure that employees comply with these policies, employers should remind employees of any flexible leave and work policies, including opportunities for telework or remote work. And if they do not do so already, employers should consider providing employees with sick leave. Paid leave and flexible leave policies don't just protect sick workers, they also protect everyone, because sick and flexible leave policies help stop the spread of infection to healthy workers. Finally, you may also be wondering whether employers have any legal obligations to protect workers from the 2019 novel coronavirus. The answer to that is yes. On its webpage, OSHA reminds employers that they are subject to the General Duty Clause of the Occupational Safety and Health Act, which requires employers to furnish to each worker employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. Because the 2019 novel coronavirus is a recognized hazard that may subject an employee to death or serious injury, the General Duty Clause applies. As always, prevention is the best medicine. Employers should preemptively analyze job activities and work settings to determine if employees are at risk or increased risk of infection. Conducting a job hazard analysis is one way to do this. OSHA's website also includes control and prevention recommendations for specific types of workers, including healthcare workers, airline workers, border protection workers, and waste management workers. The CDC has also created a special website relating to the virus specifically for healthcare professionals. OSHA also reminds employers that they are subject to the personal protective equipment standards, which require using gloves, eye and face protection, and respiratory protection. For example, pursuant to the CDC guidelines, healthcare providers treating patients with confirmed cases of coronavirus should don respirators that are at least as protective as a fit-tested NIOSH-certified disposable N95 filtering face piece respirator before entry into a patient room or care area. The CDC website has specific PPE guidance for healthcare workers. Finally, OSHA reminds employers of their record-keeping requirements, stating that the 2019 novel coronavirus is a recordable illness when a worker is infected on the job. This means that if a worker is infected with a virus on the job, employers must fill out an OSHA 300 and OSHA 300A logs. Please note that this information is based on interim guidance from the CDC and OSHA. As public health officials learn more about the novel coronavirus, more specific information about how to stop its spread will become available. Finally, anyone in China awaiting visa issuance or otherwise needing to return to the United States will not be able to board a U.S.-bound aircraft until further notice. The State Department, which issues U.S. visas, has pulled all non-essential personnel in light of the coronavirus concerns, which will delay visa processing. I hope you enjoyed this episode of K&L Gates' Working Wise podcast series. More episodes in our series can be found at knlgateshub.com, and you can learn more about our labor, employment, and workplace safety practice on our main website, klgates.com. Thank you for joining me.
Thanks again for listening to Working Wise. New episodes are available for download through iTunes, Google Play, and other podcast applications. If you have any topics you would like to hear about on the next Working Wise podcast, please send them to workingwise@klgates.com.